Hello, my name is Srivats Narayanan, and I will be presenting our project entitled Influence of Social Determinants of Health on Receiving Diabetic Foot Exams. Guidelines from many leading medical organizations have consistently recommended that patients with diabetes receive annual diabetic foot examinations. Unfortunately, many patients do not receive foot checks, which may be due to social influences. This patient outcome-focused project aimed to retrospectively characterize the social determinants of health that influence the ability of a patient with diabetes to receive regular foot exams. For our methods, the influence of social determinants of health in receiving proper medical care led to their designation as interventions of study. This study analyzed cross-sectional data from the Medical Expenditure Panel Survey 2008 to 2017, a nationally representative database. Process measures included if a patient with diabetes had ever received a diabetic foot exam. The characteristics of the sample population can be seen in Figure 1 on the right. Analyzed predictors included sex, age, race/ethnicity, insurance status, poverty status, education, and ability to schedule a routine healthcare appointment. Multivariable logistic regression was used to investigate whether such factors predicted ever receiving a diabetic foot exam. The study population included 20,865 persons with diabetes. Out of the 20,865 individuals with diabetes included in the study, 4,145 respondents had never received a foot exam. Factors associated with statistically significantly reduced odds of ever receiving a diabetic foot check included female sex, age younger than 50, Hispanic ethnicity, Asian race, no educational degree, and inability to schedule a routine appointment. Factors associated with increased odds of ever receiving a diabetic foot check were age 70 to 79, Black race, and public insurance in individuals who are not seniors. For our conclusions, nationally representative data of United States persons showed that certain social determinants of health and demographics are strongly associated with a failure to receive regular foot checks. Clinicians should ensure that diabetic foot exams are regularly conducted, especially in these aforementioned populations. For patients with diabetes who may have difficulty in scheduling future appointments, it is critical that clinicians perform a diabetic foot exam, since those patients are less likely to have a follow-up visit soon. However, this study was still limited in that it was merely cross-sectional, so causality cannot be determined between the listed social determinants of health and receiving diabetic foot exams. Thank you for your time. I hope you enjoyed this presentation.